So now we're going to move on to vaccination and spend most of the rest of this presentation on vaccines. So you all know that the FDA and the Academy of Immunization Practices have approved and recommended both the Pfizer and the Moderna vaccines, and those are being administered in the state of Oregon. And as of this week, you can see that we have had very small numbers, but they are starting to deliver the second doses. So on January 3rd of this year, 2021, TVFNR started vaccinating their frontline personnel. Vaccinations of several hundred firefighters and paramedics will continue throughout the week. And in partnership with our county public health, TVFNR will move on to vaccinate local law enforcement and other essential city and county workers in the coming months. And we can go to the next slide. So this slide is a picture of paramedic Meg Ryan. She was the first TVFNR employee to receive vaccine. She's been a paramedic since 2007 and joined TVFNR in 2017. And what she said about the vaccine is, I feel great. I'm excited for the opportunity to get it and excited to start protecting our residents. It provides everyone a little bit of hope in a time that's greatest need. I think it will give me a little more confidence when treating patients. Paramedic Jesse Gonzalez also feels relieved to be vaccinated, and he says, I'm not letting my guard down. I'm having some assurance that we're protected is a huge deal for us in the community, but we're still wearing masks inside the station. We still keep 6 feet distance, and we are taking every precaution for those that haven't received the vaccine. Fire Chief Derek Weiss was present to celebrate the vaccine kickoff and said, this has been a long time coming for me to see the first few people go through this. It's a culmination of all the hard work by the men and women across the organization. They're excited and they're encouraged about the future. There's a lot of work ahead. So the other thing I just wanted to point out is that the person giving the vaccine is Darcia. I'm probably saying this wrong. Dacia Graber, and she is representative-elect for District 35 to the Oregon House of Representatives. So that's another little tidbit for you. So we also, Washington County, received 700 doses within the first wave of vaccine, and we have provided those to TVFNR for the EMS and law enforcement vaccinations. And then we're working, looking at the other 200 doses and really trying to understand what's happening with the long-term care centers and assisted living, and working to make sure that either their facilities or we can vaccinate other high-risk populations using our MRCs and our FQHCs. So we can go to the next slide. So just a little bit of reminder, the vaccines are extremely effective, over 95% effective, and they are safe. There are some side effects, and you can see on the slide, some people are reporting fatigue, headaches, chills, body aches, and tenderness at the vaccine site. Because of a uncommon, but there have been a few severe allergic reactions. And so at this point, the guidance states that you should not receive the vaccine if you have severe allergies. And usually the way that that is defined is somebody that needs to carry an EpiPen with them. And after your vaccine, you are asked to stay for a 15-minute observation period just to make sure that you're not having any severe reactions. So I also wanted to give you an idea. So the way that this works, because we get a lot of questions about, can we vaccinate this population or that population, or really specifically questions about my mom or my aunt, or really specific friends and family. And we're happy to see that. We're thrilled to know that people want to get this vaccine for the most part. But the way that this works is the Advisory Committee on Immunization Practice makes the recommendations. So they have recommended who the priority populations are during the different phases that we've talked about. And I have a slide that will show you that a little bit more. And then CDC recommendations for distribution of the vaccine. So how to get the vaccine out there. When it gets to the state has a vaccine plan that's based on the CDC guidance and the ACIP guidance. Oregon Health Authority also has a vaccine advisory board, and they're meeting for the first time this week. And what they're really focused on is how do we ensure equitable access to the vaccines. And that's all the way from receiving it to getting it out throughout the state, and making sure that our historically underserved communities, one, understand about the vaccine, and that they have access to the vaccine and all of their questions have been answered. So at the local level, we're planning based on OHA and their plan, their guidance, their recommendations, which all flow down from CDC and ACIP. And so what we're working on then is a lot of logistical challenges. So some of it is just that the phase, that who's eligible to receive the vaccine and how do we get that vaccine to them. So for example, we talked a little bit about that teachers and school personnel have been prioritized now. And so we're working with OHA and with our local partners to determine, well, what is the most efficient and effective way to make sure that that vaccine is accessible to teachers and school personnel. And so we're doing the same right now. We're vaccinating phase 1A, group 1, because OHA within phase 1A has 4 different groups that are prioritized. One of the late-breaking pieces of news is that OHA has moved from prioritizing groups 1 through 4 on a timeline to right now they're saying anybody in groups 1 through 4 can be vaccinated. And so we no longer have to move through the groups, one group at a time. So but right now, this week, we're really focused on direct care health workers, long-term care and assisted living facilities, and as you heard, first responders, EMS, and later this week, local law enforcement. Locally, we're also really focused on community outreach and a priority to really understand what are the needs and how do we ensure that historically underserved and our disproportionately affected populations receive the vaccine. We can go to the next slide. So this is just a couple of dashboards. You can get to these dashboards either directly on the OHA COVID-19 page or through our Health and Human Services COVID-19 page. There's direct links to this. So you can see, and this was as of yesterday, you can see that in Oregon, about 51,000 people have been vaccinated. And here in Washington County, 6,400 people have been vaccinated. The bar graphs at the bottom just show the number of people vaccinated by different days. And like I said, this is changing as we're talking. So the next slide. So one of the things that I've been talking about is that we really want to ensure that our Black, Indigenous, and other populations of color, our people of color, have access to vaccine. And the first step to that, and I think our Chief Equity and Inclusion Officer has shared with you also at a presentation a few weeks ago, about the long-standing mistrust of the medical system, of government, of public health. And so we have a lot to overcome to make sure that we understand what the concerns are and that we work with these communities to address the concerns together. And so we've had some conversations with our community-based organizations in the last couple of weeks. And this is just a little sample of some of the concerns that have been raised by these community-based organizations. Concerns about what's in the vaccines. Are there any pork products or animal products within the vaccines? Fears that employers are going to require vaccination. Some people are concerned that they might get COVID from the vaccine. People are not sure about what's the process to get the vaccine. What if I don't have a doctor? I don't know where to go. And then clients not bringing it up. So maybe they're just not even asking about it or thinking about it, or when they visit their doctor, if they don't bring it up. And then the other thing that we're learning as we have these conversations, and people are confused, about what's the difference between the influenza vaccine and the COVID vaccine. And so all of this is what we're learning as we are out in the community. And several of you mentioned the great forum that the Muslim Educational Trust convened last week. And we heard some of these same kinds of concerns at that forum. And just the importance of making sure that communities understand about the vaccine and have access to the vaccine. And thanks to connections that Commissioner Treese helped make, we are working with the Muslim Educational Trust to actually provide some vaccine clinics on site when it's more broadly available. So we really appreciate that connection that you helped to make for us, Commissioner Treese. All right. Next slide. So as we talk about, and I think, we all heard from Director Allen at OHA, and we've been talking about the importance of making sure that a diverse population has access to these vaccines, in particular those that are most impacted. And you can see, I just wanted you to see that OHA is providing demographic data on their website, which we have a link to on our webpage. And beginning later this week or next week, they're going to provide this demographic data at the county level. And so I'll be able to share with you more information at the county level about who's being vaccinated and how we're doing serving our diverse communities. And you can see at this first look at the data by race and ethnicity, we're not doing very well yet. I think that the first vaccines were really focused on healthcare providers that were doing direct COVID care, taking care of COVID positive patients or patients that were at risk for COVID. And so I really hope to see this changing in the very near future. We can go to the next slide. So what's next is really moving through this timeline. And one of the first things you might look at is if you start at the anticipated timeline, it might be disappointing to see a lot of TBDs. But that is, I think somebody mentioned earlier too, even at the federal level, there's been delays in when, how much vaccine is being shipped and when it's being shipped and who it's being shipped to. So really focusing on the first two priority groups, and we've talked quite a bit about that. But we will continue to move down the phases into phase 1B, which is when we'll really start focusing on more community members that are at risk. Those over the age of 60, people that are in essential roles that help keep our community moving, and people that are in high risk categories like we saw during the summer, our food and agricultural workers, public transit, grocery workers, and we'll just continue as more and more vaccine becomes available to get out information about who's eligible and where you get that vaccine. For most of us, we're looking at this and saying, wow, I'm pretty far down on the list. Maybe I'm in phase 1C or even in phase 2 with the more general population. Most of us will get our vaccines like we do influenza, either at our healthcare provider's office or at a local pharmacy. And so as the vaccine becomes available, we'll continue to send out information through all sorts of avenues about who's eligible and where you can get your vaccine. And our public health division will be really focused on assuring that those people that we talked about earlier that may not have a doctor, our houseless population, some of our immigrant or migrant populations, our vulnerable, historically underserved populations, will be working with Virginia Garcia, with our Medical Reserve Corps, Neighborhood Health Center, to really ensure that those populations have access to vaccinations. And I think with that, I'm happy to take any questions.